Well, good morning, and my apologies for the delayed start here. Thank you for joining us. I am honored to be here with Anthony Wright, Executive Director, and Chris Noble, Organizing Director at Health Access California, a very powerful organization, as you know, fighting for health equity and on many fronts, and Kevin Wren, Outreach Lead at Insulin for All California Chapter. I'm also honored to stand here alongside three members of my very talented healthcare team who leverage the vast talent and tools of the Healthcare Rights and Access section and the entire DOJ to make healthcare more accessible, more affordable throughout California. Ranica George, Senior Assistant Attorney General, Emilio Veronini, Supervising Deputy Attorney General, and James Toma, Special Assistant Attorney General. And today we're here to take action with respect to a drug, insulin, where you often hear of the term lifesaver thrown out in casual conversation, but for many of the more than 30 million Americans with diabetes who take the drug daily to stay alive, the term has real meaning. Insulin is a lifesaver. It's the difference between a manageable disease and a painful death. But despite being a lifesaver today in America, people are losing their lives because they can't afford the drug. Over the last 20 years, big pharmaceutical companies increased the price of insulin by over 600%. Today, as many as 1 in 4 diabetics cannot afford the drug and commonly ration or stop taking insulin altogether. This is extremely dangerous and can lead to serious health consequences, including death. Big pharmaceutical companies have artificially inflated the price of insulin such that a vial of insulin may cost $300 or more when it only costs just a few dollars to make it. The increase in price is not based on cost. It's not based on research and development. It is artificially being increased. And so we ask ourselves, is this fair? No. Is this illegal? Yes, it is. That's why we're here today. We're here to announce that the California Department of Justice is suing the largest insulin makers in the world, Eli Lilly, Novo Nordisk, and Sanofi, along with the nation's largest pharmacy benefit managers, for breaking the law and deceiving the public when they aggressively hiked the cost of this life-saving drug. In short, they illegally overcharged patients, and today, California will ensure they pay a steep price. Together, the three manufacturers produce over 90% of the global insulin supply, and three pharmacy benefit managers named in our suit, those three, CVS Caremark, Express Scripts, and Optum Rx, administer pharmacy benefits for roughly 80% of the prescription claims managed. So together, these three manufacturers and these three PBMs really dominate the marketplace. In our lawsuit, we allege that because competition is highly limited in both these markets, these 6 companies are complicit in aggressively hiking the list price of insulin at the expense of patients. Again and again, they do this, year after year. Here's how it all works. The manufacturers set the list price for the drug. The PBMs then negotiate rebate agreements on behalf of their clients, those clients being the health plans. They are often paid with a portion of the rebate they have negotiated. So the higher the list price and the more it's negotiated down in this rebate, the more the PBMs profit. Because each of the dominant companies has an outsized influence on pricing at every level, a cycle of raising the list price and negotiating it down has gone unchecked. The result, the drug has risen to levels once unimaginable and become unaffordable for uninsured or underinsured patients who have to pay the full price of insulin. A vial of insulin was $25 a couple decades ago. Today it's $300. And who suffers the most from these unscrupulous business practices? People from low-income households, communities of color, working families struggling to make ends meet, even before the skyrocketing insulin copay comes due. In fact, African Americans are 60% more likely to be diagnosed with diabetes. Latinos, more than 50%. Globally, diabetes is the fastest growing disease in low-income communities. This is an issue that impacts all Californians, but Big Pharma's gouging impacts on those who can afford it the least. For them, this is an issue of equity. We're going to level the playing field, and we're going to make this life-saving drug more affordable for all who need it by putting an end to Big Pharma's big profit scheme. With today's lawsuit, we are seeking to tamper the skyrocketing cost of insulin by promoting price competition for the drug and eliminating unlawful, unfair, and deceptive practices, as well as recover restitution on behalf of all those California residents who have suffered for past overpayments for the drug. Today, we're again drawing a line in the sand. No company is too big to skirt the law or too large to be held accountable. Big Pharma might negotiate drug prices, but as your Attorney General, let me be unequivocally clear. On my watch, the health and the well-being of Californians is non-negotiable. Every Californian deserves access to affordable, quality health care. No one should have to worry about whether they can pay for life-saving medication, period. Our fight continues, and we look forward to seeing these companies in court. With that, I'll now introduce our next speaker, Anthony Wright, Executive Director at Health Access California. Anthony.
Thank you so much, Attorney General Bonta. My name is Anthony Wright. I'm the Executive Director of Health Access California, the statewide healthcare consumer advocacy coalition. And we want to thank the Attorney General for your action today to help address the inflated cost of insulin. Californians are crying out for real relief from the ever-increasing cost of prescription drugs. They have increased by over $700 million for Californians just in 1 year between 2020 and 2021. According to a report by the California Department of Managed Healthcare just last month. In that same report, it indicated that the price of medications, again, for just in California managed healthcare plans, went up 22% in 5 years, to $10.8 billion, and is now a greater percentage of our premiums. So Californians feel these high prices of prescription drugs in our premiums and in their monthly visit to the pharmacy, especially if they're paying out of pocket, if they're uninsured, if they're underinsured. So we want to make sure that Americans are no longer paying more for prescription drugs than anybody else in the entire world. Americans are charged more than anybody else in the entire world when they pay out of pocket. And insulin is a particular poster child for inflated prices. A recent Wren study showed that in the U.S., we often pay 10 times more or more for insulin than in other countries in Europe or Asia or beyond. So consumer advocates have long championed and campaigned for prescription drug price reforms, even running ballot measures where we had record-breaking dollars on the other end to defeat them. But we're glad that there is action being taken by our policymakers in Congress with the Inflation Reduction Act to negotiate the price of Medicare. And we are proud in California of action being taken on multiple levels. Here to, for example, consolidate our purchasing power in Medi-Cal, or to directly contract for the manufacture of generics to deal with the market failure that leads to inflated prices. Now, that's an action that the governor and the legislature are taking, using their power as a large purchaser. But we're really gratified that the Attorney General is using his authority, his power as a consumer protection agency, using the courts to go directly at this issue of the inflated cost of insulin. We believe that this is a long-standing issue, and we're glad that Attorney General Bonta is taking it on. And on behalf of the 3 million diabetic patients in California, and all who pay high premiums and high drug prices, we thank Attorney General Bonta for his leadership in dealing with these anti-competitive practices and using his power to improve access and affordability for this essential medications. We all have our stories. My mom was a diabetic. This is really important. I would like to introduce my colleague, Chris Noble, our Director of Organizing, who can also tell his story. Thank you very much. Chris.
Thank you, Anthony. Thank you. Hi, everyone. My name is Chris Noble, and I'm the Organizing Director for Health Access California, California's Consumer Health Advocacy Coalition. I've also been dependent on insulin for my survival for the last 27 years. Yesterday was the 101st anniversary of insulin's discovery as a life-saving essential medicine for people with insulin-dependent diabetes like myself. In fact, the doctors who initially discovered insulin back in the 1920s saw its Lazarus-like ability to bring their diabetic patients back from near death and sold their patent for $1 to help people everywhere around the world access the life-saving therapy. When I was first diagnosed as a child with insulin-dependent diabetes back in the mid-90s, one vial of the newly launched analog insulins cost about $25, $26 a vial, which at the time lasted me about a month. Now, in 2023, that exact same vial of insulin is priced over $300 and lasts me about 2 weeks. I'm very fortunate to have excellent health insurance that reduces my out-of-pocket healthcare costs for now. But if I were to lose my health insurance, or if I were to be put into a situation where I couldn't regularly access insulin, the clock would begin ticking until my body would inevitably begin to shut down, and within a couple of days, I would surely die. Far too many of my peers, without insurance or with high deductible plans, have had to go to Mexico or Canada, where insulin costs a fraction of what it does here. Countless others have launched GoFundMe pages or resorted to black market exchanges with strangers on the internet to get access to the medicines that they need, that we need to survive. I purposefully keep extra insulin stock on hand so I can help in these exchanges whenever asked. This is not a sign of a functioning healthcare system, and I'm so thankful to live in a state like California, where consumer advocates and our champions in the legislature and the Attorney General's office are fighting for new ways to develop and distribute affordable insulin, either via public production or by streamlining the state's purchasing power in public programs like Medi-Cal. I'm also extremely thankful to Attorney General Bonta's commitment to investigate these companies and bring much-needed relief and restitution to the 3 million diabetics residing here in California and to the hundreds of millions of us around the world. Together, these efforts can ensure insulin's next century as a life-saving therapy brings life and opportunity to people living with diabetes like myself. To share a bit more about his experience, I'd like to introduce our next speaker from the Insulin for All California chapter, Kevin Wren.
Hello, I'm Kevin Wren. I'm with the California chapter of Insulin for All, a nonprofit that is driven by patient voices, and we do not take pharma money. My grandma was diagnosed 50 years ago with type 1 diabetes. She lived with the disease for a long time, and the price of insulin remained relatively unchanged in her lifetime. I was diagnosed in 2001, and I first rationed in 2009. My story is not unique. Nearly 1 in 4 people with diabetes have rationed insulin. This is unconscionable. The drug is over 100 years old and costs $5 to make, yet it costs us $300. I constantly use it, and without it, I start to die a painful death within a couple days. I've had ketoacidosis, I've been hospitalized, have complications, all because I rationed my insulin. This shouldn't happen. The rest of the world pays $30 for what we pay for $300. We account in the United States for 2/3 of their profits. That's 60% of their sales. We account for only 10% of the global diabetes population. This exploitation and extortion has to end. I help nearly 1 person every month source insulin. I skirt the law by providing someone else's prescription, some overages that they might have, also that they don't have to ration. The programs set up by Eli Lilly, Novo Nordisk, and Sanofi do not help. They only seek to exculpate themselves from blame and to pay a minimal amount in taxes. They are not helping patients. They're helping their shareholders, and this needs to stop. I believe this move by the AG today will set a precedent for all of America so that we don't have to be living in fear of not being able to afford the most essential medicine we need to live. They know we need it, and they exploit this, and this needs to end. Thank you.
Thank you. Well, thank you. I deeply appreciate the partnership, and thanks to the testimony of Mr. Wright and Mr. Noble and Mr. Wren. I'm grateful to have an opportunity to use the full force of the law here and the full authority of my office to make a difference. And we know that we cannot accept the unacceptable, the status quo, when it comes to insulin being provided to those in need who are wrestling with and suffering from diabetes is unacceptable. And so we've brought this lawsuit today, and proud that it works hand in hand with other important efforts that California has initiated, including the governor, in his wisdom, preparing to make our own insulin here at the state of California. We invite and we hope legislative bodies, state and federal, will also take action. Senator Eggman has been hard at work in this space, working to provide regulatory oversight for our PBMs that is reasonable and appropriate. And so all of those efforts are rowing in the same direction, part of the same solution. We all have our own levers to pull and to use, and today the DOJ is pulling our levers. So with that, I'm happy to answer any questions that we might have.